Hi, welcome everybody to my YouTube channel. I am Dr. Pradeep Kumar Shenoy, consultant rheumatologist at Amrita Multi-Specialty Clinic, Attawar, Mangalore. This is the first rheumatology clinic of Dakshina Kannada and Udupi district. In this video, we will look into psoriatic arthritis. If a patient comes to the rheumatologist with pain and swelling of the joints of the hands, of the fingers of the hands, then, when the rheumatologist examines the fingers and the hands, and if he finds that there are some strange findings in the nails, like pitting, onycholysis, subingual hyperkeratosis, etc., these are the nail changes that is found in skin psoriasis. He looks for psoriasis, skin psoriasis in the knees and elbows. If he finds there, it's good. If the skin lesions are not found in elbows and the knees, then he looks for hidden areas of skin psoriasis like scalp, nape of the neck, behind the ears, below the breast, around the umbilicus, in the gluteal cleft, etc. So if he finds the skin psoriasis in the hidden areas or the elbows or the knees, he makes, along with the nail changes, a diagnosis of psoriatic arthritis. Psoriatic arthritis, unlike rheumatoid arthritis, is not a homogeneous group of disease. They are heterogeneous group of diseases. There are five types of psoriatic arthritis. They are DIP predominant psoriatic arthritis, rheumatoid arthritis like symmetrical arthritis, arthritis mutilans, asymmetrical oligoarthritis, and psoriatic spondyloarthritis. Psoriatic arthritis, like any other seronegative spondyloarthropathy, affects both axial as well as the peripheral joints. In the vertebrae, it affects the vertebral bodies and produces inflammation along with the disc associated with it. This is called as spondylodiscitis. If you consider the disc has got two structures, inner nuclear pulposus and outer annulus fibrosus. So in psoriatic arthritis, there is calcification of the outer fibers of the annulus fibrosus and the inflammation of the vertebral bodies. Ultimately, contiguous vertebrae undergo fusion and they are called as a syndesmophyte formation. In the peripheries, it produces inflammation in the joints with pain and swelling. But the arthritis which are axial, that is the vertebral inflammation, is more difficult to control. But drugs like sulfasalazine, small molecules like tofastatinib, biological response modifiers like infliximab can take care of axial joint inflammation. Peripheral joint inflammation is taken care of by the methotrexate. If you combine methotrexate and sulfasalazine, both axial as well as peripheral joint inflammation is controlled. But there are some interesting factors about psoriasis and psoriatic arthritis. There are certain syndromes like Shaffer syndrome, which stands for synovitis, acne, pustulosis, hyperostosis, osteitis, as well as psoriatic onychopachydermoperiosteitis. So there are other disorders which are variant of skin psoriasis. Psoriasis is an illness where innate immune system and adaptive immune systems are involved. So this makes skin psoriasis and psoriatic arthritis as a very interesting topic. In patients with psoriatic arthritis, 18 to 25% of the patients are HLA-B27 positive. In about 60 to 80% of the patients with psoriatic arthritis, skin involvement starts first, 10 to 20 years before the development of arthritis. In about 60 to 80% of the patients, the skin psoriasis starts. In about 15 to 20% of the patients, arthritis starts first, then subsequently the skin lesions develop. About 30% of the patients with skin psoriasis develop psoriatic arthritis. And the extra articular manifestations, unlike rheumatoid arthritis, are not so common in psoriatic arthritis. Uveitis involvement in psoriasis and psoriatic arthritis is about 7.6 percentage. So psoriasis is a very interesting topic, but for everything, including skin psoriasis, psoriatic arthritis, we have treatment in allopathy. So biological response modifiers tacrolimus ointments, cyclosporin, and much more in the armamentarium. So psoriasis is not because of sarpashapa or something. They are absolutely autoimmune illnesses. So anybody who's suffering from skin psoriasis and psoriatic arthritis, you are welcome to allopathy and rheumatology. Long live IMA, IRA, and API. Thank you.